If you've ever walked into a room and forgotten why you're there, I want you to keep watching, because in the next few minutes, I'm going to walk you through 7 warning signs that your memory changes might be more than just normal aging. And sign number 4 is the one that catches almost everyone off guard, including a lot of my own patients who were sure it couldn't apply to them. By the end of this video, you'll know exactly what's worth paying attention to, what's probably nothing to worry about, and what steps you can take starting today to support your brain health for years to come. So let's get into it. First, let me say something that I think gets lost a lot in conversations about memory and aging. Forgetting things sometimes is completely normal. Misplacing your keys, blanking on a word every now and then, walking into the kitchen and forgetting what you came for. These things happen to people in their 30s and 40s too. The brain isn't a perfect machine, and a little bit of forgetfulness is simply part of being human at any age. What I want to help you understand today isn't how to panic over every small slip. It's how to tell the difference between the ordinary, forgetful moments we all have, and patterns that may be worth a closer look. Because here's the thing, the earlier you notice a real pattern, the more options you may have. Some causes of memory changes are related to things like sleep, stress, certain medications, or nutrition, and those are often very manageable once identified. Others are worth discussing with your doctor simply so you can rule things out and have peace of mind. Either way, awareness is what puts you back in the driver's seat, and that's exactly what we're building together today. So let's start with warning sign number 1. Repeating the same question or story within a short period of time without realizing you've already said it. Now, we all repeat ourselves sometimes. Maybe you tell a favorite story at 2 different family gatherings because you simply forgot you'd already shared it a few months back. That's normal. What's different here is asking the same question, like, what time is the appointment? 3 or 4 times within the same hour, each time as if it's the first time you've asked. This isn't about being repetitive out of habit. It's about the information simply not sticking, even for a few minutes. If you've noticed a loved one doing this, or if you've noticed it in yourself, it doesn't automatically mean something serious is going on. Stress, poor sleep, and even dehydration can affect short-term recall temporarily. But if it becomes a consistent pattern over weeks, it's worth mentioning to a doctor, because catching changes early may open up more options for support. Here's the part most people miss, though. This sign is often more noticeable to the people around us than to ourselves. Our brains are very good at filling in gaps without us realizing it, so if a spouse, a sibling, or a close friend gently points out that you've asked something multiple times, try not to brush it off defensively. That observation is actually valuable information, and it's one of the reasons why staying connected with people who see you regularly is such an important part of protecting your long-term health, not just your emotional well-being. I hear this story a lot in different forms. A husband who asks his wife 3 times in one afternoon what time their daughter is arriving. A mother who calls her son twice within an hour to ask about the same doctor's appointment, with no memory of the first call. In almost every case, the family member noticed it long before the person experiencing it did, simply because repetition is much easier to spot from the outside looking in. That's not a failure on anyone's part, it's just how human memory and self-awareness work. We don't have a little notification that pops up in our own minds saying, "You already asked this." So, if someone close to you brings up a pattern like this, try to receive it the way you'd want to receive a warning about anything else affecting your health, as an act of care, not criticism. It's also worth saying that context matters here. Someone going through a period of high stress, grief, or poor sleep may repeat themselves more than usual simply because their working memory, the mental scratch pad we use to hold information for a few minutes at a time, is temporarily overloaded. This is one of the reasons doctors often ask about sleep quality, recent life changes, and stress levels before jumping to any other conclusions. So if you've noticed this pattern in yourself or someone you love, it's worth asking honestly, has anything else changed recently? Sometimes the answer points to something manageable and temporary. Other times, it points towards something worth a more thorough conversation. Either way, you're better off having the information than not. Let's move to warning sign number 2. increasing difficulty following a conversation or a storyline, especially when there are multiple people talking or when the topic shifts quickly. Maybe you used to love watching mystery shows and following every twist, and now you find yourself lost halfway through, unable to recall who's who or what already happened. Or maybe in a group conversation at dinner, you find it harder to keep up when the topic changes from the weather to grandkids to a doctor's appointment, all within a few minutes. A little bit of this is completely normal. Busy environments are genuinely harder to process for everyone as we get older, since our brains are managing more incoming information at once. What's worth paying closer attention to is when this becomes frequent, even in calm, one-on-one conversations, or when it starts affecting your confidence in social situations to the point where you begin avoiding them. There's a specific version of this that comes up often enough that I want to mention it separately: television and movies. So many people tell me they used to enjoy shows with complex plots, multiple characters, or twists that required you to remember details from earlier episodes, and over time they find themselves gravitating towards simpler content, not because their tastes changed, but because keeping track of who's who started to feel like work instead of entertainment. If you've noticed yourself quietly avoiding shows you used to love for this reason, that's worth paying attention to. It's a small, everyday example, but small, everyday examples are often where these patterns show up first, long before they show up anywhere more serious. The same thing can happen in group settings: family dinners, book clubs, card games with friends. These all require what's called divided attention, where your brain is tracking multiple threads of information at once. It's genuinely one of the more demanding things we ask our brains to do, and it's completely normal for this to get somewhat harder with age. What matters is the trajectory. Is this something that's stayed roughly the same for years, or is it something that's clearly gotten more difficult over the past several months? That distinction, stable versus declining, is one of the most useful things you can bring to a conversation with your doctor, because it helps separate normal aging from something that deserves a closer look. I want to pause here and give you something encouraging, because I don't want this video to feel like a checklist of fears. Many of the changes we're talking about respond well to simple daily habits: staying socially engaged, getting consistent sleep, managing stress, and staying physically active have all been studied for their potential role in supporting cognitive health as we age. Some research suggests that even something as simple as a daily walk may support healthy blood flow to the brain. We'll talk more about practical steps like this near the end, so stick with me, because I think you're going to find that section genuinely useful, not just informative. Now, warning sign number 3, getting disoriented in familiar places. This one tends to worry people the most when they hear about it, so let me be really clear about what this does and doesn't mean. We're not talking about occasionally missing a turn on a new route, or forgetting where you parked in a large parking lot. Those things happen to almost everyone. What's different here is becoming confused in a place you've been to hundreds of times, like your own neighborhood, your regular grocery store, or even parts of your own home. Some people describe it as a brief moment of, "Where am I?" that passes quickly but leaves them shaken. Others notice they have to consciously think through directions that used to be automatic, like the route to a family member's house they've driven for years. If this happens once, in a moment of distraction or during a particularly stressful week, that's not necessarily something to be alarmed about. But if it starts happening more than once, or if it happens in truly familiar settings, that pattern is worth bringing up with a healthcare provider. Doctors have tools to help understand what might be behind changes like this, and many of the possible causes are very treatable, especially when caught early. This is exactly why I don't want you walking away from this video scared. I want you walking away informed, because informed people tend to act sooner, and acting sooner tends to lead to better outcomes. Let me share the kind of story I hear often, because I think it helps make this concrete. A woman in her 70s drove to her regular hair appointment, a salon she'd been going to for over a decade, and for a brief moment, sitting at a stoplight 2 blocks from the salon, she genuinely couldn't recall which direction to turn next. It passed within a few seconds, and she made it there just fine. On its own, that single moment might mean very little. Everyone has moments of mental fog, especially during a stressful week or a poor night's sleep. But when her daughter mentioned that this had happened twice more over the following month, that pattern was worth bringing to her doctor. It turned out, in that particular case, to be related to a change in blood pressure medication, and once that was adjusted, the episode stopped. I share that story not to tell you every case resolves that simply, but to show you why patterns matter more than single moments, and why bringing things up early tends to lead toward answers rather than away from them. I also want to gently mention something here, because I think it's important. Getting disoriented while driving specifically is worth taking seriously enough to mention to a doctor sooner rather than later, simply because of the safety implications for you and for others on the road. This isn't about taking away anyone's independence prematurely. It's about making sure any changes are properly understood so that decisions, if they're ever needed, are made thoughtfully and with good information, rather than after something unfortunate happens. Alright, now we're getting to warning sign number 4, the one I mentioned at the very beginning, and it's one that surprises almost everyone because it doesn't look like a memory problem at all on the surface. Warning sign number 4 is difficulty with planning or problem solving in situations that used to feel simple. Things like following a familiar recipe, managing monthly bills, or keeping track of a step-by-step task. Here's why this one is so easy to miss. When we think about memory issues, we usually picture forgetting names or dates. We don't usually think about struggling to follow a recipe we've made 100 times, or losing track of which bills have been paid this month, or taking much longer than usual to work through a task that used to be second nature. But cognitive changes don't only affect memory in the traditional sense. They can also affect what doctors call executive function, which is essentially the brain's ability to plan, organize, and carry out multi-step tasks. This is why so many families miss this sign for a long time. They're watching for forgetfulness, and instead what's happening is a change in organization and follow-through, which looks completely different from the outside. If you've noticed that tasks which used to take you 20 minutes now take an hour, or that you're making more small errors in things like paying bills or following instructions, that's worth paying attention to. Not out of fear, but out of the same practical mindset you'd use for any other change in your body. You wouldn't ignore a change in your eyesight or your hearing, and this deserves that same level of attention. Let me give you a few more everyday examples, because I think seeing this in concrete terms makes it much easier to recognize. Someone who used to effortlessly plan a holiday dinner for 12 people, coordinating dishes, timing, and who's bringing what, starts finding that same task genuinely overwhelming, even though nothing about their kitchen or their recipes has changed. Someone who's balanced a checkbook for 50 years starts making small, uncharacteristic errors, or starts avoiding the task altogether because it now feels stressful instead of routine. Someone who used to assemble furniture or follow a set of instructions without a second thought now finds themselves rereading each step multiple times and still feeling unsure. None of these, by themselves, mean something is seriously wrong. People get tired, distracted, or simply less interested in tasks they've done 1,000 times. But when a family member says, "That's not like them," that observation is worth taking seriously, because family members are often better at detecting a change from someone's personal baseline than the person is themselves. I also want to mention something that surprises a lot of people. This sign is one of the more common early indicators that families miss for a long time, sometimes for a year or more, precisely because it doesn't look like a classic memory problem. Families are often watching closely for forgotten names or missed appointments, and meanwhile, the more telling sign has been sitting quietly in the monthly bills, or in a recipe box, or in a task that keeps getting put off because it now feels harder than it used to. If any of this sounds familiar, take a moment after this video and think honestly about whether a task that used to be routine has quietly become a source of stress. That single reflection might be more valuable than anything else in this entire video. Let's keep going, because we've got 3 more signs to cover, plus some really practical steps at the end that I think you're going to find genuinely useful. Warning sign number 5. Noticeable changes in mood or personality that don't match your usual self, especially increased confusion, apathy, or withdrawal from activities you used to enjoy. This is one that's often more visible to family members than to the person experiencing it. Maybe a spouse who used to love gardening every weekend suddenly shows little interest in it. Maybe someone who was always the one organizing family get-togethers starts avoiding that responsibility, not because they're tired, but because the planning itself feels overwhelming in a new way. Mood changes are complicated, and I want to be very careful here, because depression, grief, and major life transitions like retirement can absolutely cause similar symptoms, and those are just as important to address, separately from any conversation about memory. The key here isn't to jump to conclusions about what's causing a mood or personality shift. It's simply to notice that a shift has happened, and to treat that as useful information to bring to a conversation with a healthcare provider who can help sort out what might be behind it. I think this sign deserves a little extra attention because it's easy to misread. A person who withdraws from hobbies or social plans might be quietly labeled as just getting older or slowing down, when in reality, something more specific may be happening beneath the surface. Sometimes related to mood, sometimes related to cognition, and sometimes both at once, since the two are more connected than most people realize. If a loved one stops calling friends they used to talk to every week, or stops attending a church group or card game they once looked forward to, resist the urge to explain it away too quickly. A gentle, caring question, "I noticed you haven't been to your Tuesday group lately. Is everything okay?" can open a door that leads somewhere important, whether that's a conversation about mood, about memory, or simply about needing support with something specific, like transportation or hearing difficulty in group settings. Warning sign number 6. Struggling to find the right words during conversation, beyond the occasional tip-of-my-tongue moment we all experience. Almost everyone, at any age, has moments where a word just won't come to mind. That's completely normal, and it happens more as we get older, simply because our brains are storing more information over a longer lifetime. What's different here is when this becomes frequent enough to noticeably interrupt conversation, or when someone starts substituting vague words like thing or stuff for common, everyday objects they've always been able to name easily. Some people also describe difficulty following or contributing to conversations because they lose their train of thought partway through a sentence. Again, this happening occasionally, especially when you're tired or stressed, is not a red flag by itself. It's the frequency and the pattern over time that matters, not any single moment. I want to note something interesting here because it often surprises people. Many individuals experiencing this pattern become quite skilled at working around it, sometimes without even realizing they're doing it. They might switch to shorter sentences, lean more on gestures, or let someone else in the conversation fill in words for them. Family members sometimes describe this as the person becoming quieter in group settings, without necessarily connecting it to word-finding difficulty at all. If you've noticed a loved one gradually speaking less in conversations they used to actively participate in, it might be worth gently exploring whether word finding has become part of the reason why. And warning sign number 7, the last one on our list, misplacing items in unusual locations combined with an inability to retrace steps to find them. We all misplace things, glasses, keys, the remote control. That's not what we're talking about here. This sign is more specific. Putting an everyday item somewhere it would never normally go, like keys in the refrigerator or a wallet in the freezer, and then being unable to work backward through your day to figure out how it got there. This is different from simply forgetting where you set something down, because in that case, most people can retrace their steps and eventually find it. The concerning pattern is the combination of unusual placement plus an inability to reconstruct how it happened. Sometimes this sign comes with an added layer that's worth mentioning. A tendency to become suspicious that someone else moved or took the item, simply because there's no memory of placing it somewhere unusual. This isn't about someone's character or honesty. It's a very human response to a confusing situation. If your own mind has no record of putting your wallet in the freezer, the far more intuitive explanation is that someone else must have done something with it, not that you did something you can't recall. If this dynamic has come up in your household, try to respond with patience rather than argument. It's rarely productive to insist on what really happened in the moment. It's far more productive to note the pattern quietly and bring it up later, calmly, ideally in the context of a doctor's visit where it can be discussed constructively. So that's all 7 signs. Let me do a quick recap because I know that's a lot of information to take in. Repeating questions or stories within a short window. Difficulty following conversations, especially in group settings. Getting disoriented in genuinely familiar places. Struggling with planning and multi-step tasks, even simple ones like recipes or bills. Noticeable mood or personality shifts, especially apathy or withdrawal. Frequent word-finding difficulty beyond the normal tip-of-the-tongue moment, and misplacing items in unusual places without being able to retrace your steps. Now here's what I really want you to take away from this video, and it's more important than the list itself. None of these signs, on their own, are a diagnosis. They're not even necessarily anything to worry about. What matters is pattern, frequency, and change from someone's own personal baseline. A single instance of any of these things is part of being human. A consistent pattern over weeks or months is what's worth a conversation with a healthcare provider, not because something is definitely wrong, but because getting information early tends to give people more options, more peace of mind, and more time to plan, whatever the outcome turns out to be. So let's talk about what you can actually do with this information, because I don't want to leave you with a list of concerns and nothing constructive to do about it. First, if you're noticing some of these patterns in yourself, write them down. Keep a simple, low-pressure log, not to obsess over it, but so that when you do talk to a doctor, you can describe specific patterns instead of vague feelings, which makes it much easier for them to help you. Something like, "I've asked my daughter the same question 3 times this week," is far more useful to a doctor than, "I feel forgetful lately." Second, if you're noticing these patterns in a loved one, approach the conversation with warmth rather than alarm. Nobody responds well to being told something is wrong with you. Instead, try something like, "I've noticed a few things lately and I care about you. Can we talk to your doctor together just to check in?" Framing it as a team effort rather than an accusation makes a real difference in how that conversation lands. Third, and this applies to everyone watching, regardless of whether you're noticing any of these signs, there are daily habits that some research suggests may support brain health over time. Let me walk through these one at a time, because I think the specifics matter more than a vague list. Physical activity is probably the habit with the most consistent research behind it. You don't need an intense exercise program. Some studies suggest that even a daily 30-minute walk may support healthy blood flow to the brain and may play a role in supporting cognitive function over time. If a full 30 minutes feels like a lot, even breaking it into 2 15-minute walks, morning and afternoon, appears to offer meaningful benefit according to some research. The type of movement matters less than the consistency of it. Sleep is the habit people underestimate the most. During deep sleep, the brain goes through a kind of nightly housekeeping process, clearing out waste products and consolidating the day's memories into longer-term storage. Chronic poor sleep, whether from insomnia, untreated sleep apnea, or irregular sleep schedules, has been studied for its potential connection to memory and cognitive changes. If you snore heavily, wake up gasping, or feel exhausted despite a full night in bed, that's worth mentioning to your doctor specifically, because treating an underlying sleep disorder can sometimes lead to noticeable improvements in day-to-day memory and focus. Social connection is one that's easy to deprioritize, especially later in life when social circles naturally shrink due to retirement, relocation, or losing loved ones. But some research suggests that regular social interaction may help keep the brain actively engaged in ways that solitary activities simply don't replicate, because conversation requires real-time processing, memory, and problem-solving all at once. This doesn't have to mean big social events. A weekly phone call with a close friend, a standing coffee date, a religious or community group, or even a regular volunteer commitment can all count. Mental engagement is another piece of the puzzle, though I want to be careful here because this is an area where marketing sometimes outpaces the actual research. You don't necessarily need a specialized brain training app or program. Reading, learning a new skill, playing a musical instrument, doing puzzles, or even picking up a new hobby that requires learning. These all engage the brain in ways that may be supportive over time. The key seems to be novelty and challenge, not repetition of something you've already mastered. And finally, managing chronic health conditions matters more than most people realize when it comes to brain health specifically. Conditions like high blood pressure, diabetes, and high cholesterol have all been studied for their potential connection to long-term cognitive health, since they affect blood vessels throughout the body, including the ones that supply the brain. Staying on top of regular checkups and following your doctor's guidance for managing these conditions isn't just about your heart. It may also be one of the more meaningful things you can do for your long-term cognitive well-being. None of these are guarantees, and I want to be honest with you about that. But they're low-risk, low-cost habits that support your overall well-being, regardless of memory, so there's very little downside to building them into your routine. Fourth, don't wait for a big enough reason to bring something up with your doctor. A lot of people, especially in this stage of life, feel like they need to have a dramatic symptom before it's worth a doctor's time. That's simply not true. Doctors would always rather hear about a small pattern early than a big concern late. You are allowed to bring up something that feels minor. That's not wasting anyone's time. That's exactly what preventive healthcare is for. And finally, remember that a memory concern is not the same thing as a memory diagnosis. There are dozens of things that can affect memory and cognition temporarily. Certain medications, thyroid changes, vitamin deficiencies, sleep disorders, stress, and grief, just to name a few. Many of these are very treatable once identified, which is exactly why bringing up concerns early is so valuable. You're not looking for bad news, you're looking for clarity, and clarity is almost always a good thing, no matter what it turns out to be. I hope this video gave you a clearer, calmer way to think about memory and aging, not through fear, but through awareness and practical next steps. If even one of these 7 signs resonated with you, whether for yourself or someone you love, I'd really encourage you to write it down today and bring it up at your next appointment, or even schedule one specifically to talk about it. You deserve clear answers and a plan, whatever that plan turns out to be. If this video helped you, it would mean a lot if you hit subscribe, so you don't miss the next one, where we're going to dig into some of the daily habits I mentioned today in a lot more detail, including specific, practical ways to support your brain health starting this week. And if you found this helpful, drop a comment and let me know which of these 7 signs surprised you the most. I read every single one, and it genuinely helps me know what to cover next for you. Take care of yourself, and I'll see you in the next video.